you found the diagnosis, you've got 10 days to come to wraps with what's next.
Yeah.
Talk me through that.
Okay. You know, I suppose I probably cried so much from the diagnosis up until the point of the 10 days prior, and I think I was all cried out.
Yeah.
There wasn't any more tears to shed. And I just became very stoic, or I don't know, this brave maybe. I don't know where it came from.
Yeah.
But, you know, I have my family around me as well. And, you know, we did things like, you know, like I remember the day before the operation, I went out with my now daughter-in-law, and we just went and had a look at some wedding dresses.
Yeah.
I did some art.
Yeah.
It was the last painting I've actually painted.
Yeah.
Then, you know, little things like, you know, my last shower standing on two legs. The last time I walked down the stairs with two legs.
Yeah.
We walked in the park with my two legs, you know, sort of taking each step, you know, even though I was in a lot of pain.
Yeah.
I did all of that beforehand and drove me to the hospital, and I was pretty okay about it. I was like, let's get this, let's get this done, because I needed to jump into the next stage. And really, I had a lot of consultations, you know, the amputee clinic beforehand, you know, speaking to the orthopedic surgeon, trying to give me as much information as possible, but no one can really prepare you for a hip disarticulation. And for those that don't understand a hip disarticulation, I've lost my hip joint. Sorry, I'll go down the other way.
Yeah.
I've lost my ankle joint, my knee joint, and then my hip joint. So I still have my pelvis intact. And you really need your femur to bend and to sit and everything like that. So I'm like, I'll be amputated. This is not a great idea, losing a hip. But and I was told that I probably wouldn't be able to walk more than 100 meters, 200 meters. And, you know, in a prosthetic, that I have probably be in a wheelchair, or I could be, you know, just using crutches all the time. And because some people cannot wear prosthetics with this particular type of amputation. So I just said, no worries, we'll do it. What can you say, you know? So anyway, the operation happened, and obviously I was in ICU. And one of the strangest feelings was waking up, having my family around me, and me saying, you know, I had a epidural as well, but I could feel my right leg hovering above the bed. Now that's phantom pain, and I said that. I said, you know, my leg is hovering above the bed. And I think everyone thought I was nuts. Then of course they're saying it's your phantom, your sensation. I hadn't hit yet the phantom pain yet, because that happens a few days later. When most of the medication is worn off, or they have to change it up. So once the epidural was out, that's when
it kicked in.
The medication really, it was really hard. I would have to say it was for me, excruciating pain. Excruciating. I've never been, and I've had 2 babies. This was nothing compared. Compared to the pain that I had to endure. And there was I was lucky too. We got negative margins. And there was a lot of fiddling around, you know, they're changing around your anatomy as well. And that's part of the reason why it hurts. And the swelling, and it's been quite a journey since then.
How long were you in hospital for? after that initial
Well,
surgery?
only about 2.5 weeks. And the reason that it was probably 2.5 weeks is because the medication they had to get right with me.
Yes.
And most things weren't helping.
Yep.
So that was the reason. And then also they were waiting for a bed at rehab where I went to rehab elsewhere. And then I did another 2 weeks at rehab. So good 4.5 weeks away from home.
Yes.
And I left rehab on the very day that whole of Sydney went into lockdown with COVID.
Yeah.
So I didn't know what was going on.
Yeah. You are so brave, inspirational, just such an amazing woman. And when you hear the 10 days, the story, the lockdown, all these challenges, you just attack them with such equal parts grace, but equal parts determination.
Yeah, it's a lot of determination.
You're phenomenal.
Yeah. I mean, it's hard on reflection as well, because in 2020, when you have an amputation, my brain wasn't right.
Yes.
Because it takes a while for your brain to find some normality, and I was on a lot of medications, and some of those medications were not good for me.
Yes.
And I was getting numb fingertips and numb toes on my left side, and I couldn't hold a conversation with my husband or any of my children at all. I was almost dead in a sense as well, that if someone said something about themselves, I just couldn't care less, which sounds horrible, but I really couldn't care less. It was really the medication that was doing that. And also too, looking at people out the window exercising, because everyone was out walking during COVID, and we had a lot of traffic, a lot of foot traffic going past our house. And I was so upset that was supposed to be me out there, but I was with one leg and struggling at that time to just walk around the house with crutches. So I had to learn everything, and in excruciating pain. Then 7 weeks later, I started radiotherapy. I didn't need chemotherapy. This chemotherapy they don't use for this particular type of sarcoma. And I did 5 weeks of continual radiation, and then a week and a half after that, that's when I got an infection, and everything went downhill after that. And I had subsequent, what they call debridements and washouts. Really wasn't able to use a prosthetic. So I was delayed. So I became a crutch user. It's probably where I started getting my strength. Then I ended up in hospital for another 2 months.